All right, let's get started. So welcome, good morning, good afternoon, good evening. Glad to see those that have joined. My name is Laura Kohler. I'm a Senior Advisor Sanitation with WaterAid, and today I'll be the host for this morning session. Today is the final session of the Safely Managed Sanitation series on strengthening the sanitation workforce. Before we do move forward, please remember to select your channel for interpretation. We have interpretation in French for this session. And for the rest, you are all well-seasoned webinar participators at this point, so no need to cover it. But we really do look forward to your participation throughout the session, throughout the next hour. And if you do need assistance, please use the chat. So after we have a brief introduction to the steps, we will jump into a framing presentation on HR capacity by Andy Narracott from UNICEF. And then we will have two presentations highlighting two distinct approaches to addressing HR capacity for sanitation services and their systems. And then finally, we'll have some Q&A and reflections to wrap up. So why these safely managed sanitation steps? We know that we need to dramatically accelerate progress on sanitation, and that better sector alignment and coordination is needed more now than ever to be able to accelerate. And at the same time, we know that there is still a major gap in understanding when it comes to safely managed sanitation and when it comes to terms like climate resilient sanitation, and how to actually integrate safely managed sanitation into national policies, plans, regulations, standards, et cetera, and actually down to the implementation. So this framework isn't anything new, but it was designed as sort of a checklist to help demystify these questions and navigate through the existing guidelines and tools that are out there. And if you haven't already taken a look at the document itself, it's available online, as well as the recordings from the previous sessions of this webinar, which are available on Susanna. And each session gives an overview of those 8 steps. The initial framework, as a bit of background, the initial framework ideas were tested at the first Global Sanitation Summit held in Nepal in June last year. It was co-hosted by UNICEF, WHO, and WaterAid with technical support from S&V and other sector partners. It brought country delegates from over 25 countries. They were able to share their efforts towards SDG 6.2. They discussed common as well as context-specific challenges and came up with their own action plans, action points to take forward. To extend that exchange beyond those that attended last June, this webinar series was launched to revisit and build on the learnings from that exchange, but was, designed to include many more from the sector and to share learnings and to have these discussions. That brings us to today's session on HR capacity strengthening. While it is the last in the series and as a step, it is very important. Its place does not have any significance at all. It underpins all aspects of a strong system. So first, we need to have people interested and working in sanitation, interested in having sanitation jobs. And then those people need to be competent. They need to have the right knowledge, skills, and attitudes to carry out their role. And we know with sanitation, it's highly complex. And so those knowledge, skills, attitudes are quite varied, depending on the role that the individual would play. And this shows that include sanitation workers, as you can see here, those that provide the various services along the sanitation value chain, from emptying all the way through operations, those installing on-site systems, but it also includes a number of other additional functions looking at regulation, policymakers, engineers, and even those that are designing and delivering professional development opportunities, such as training, or we might refer to them as the suppliers of capacity strengthening. But essentially, having competent people in all aspects of the system is important, not just thinking of service delivery. And that's it's what underpins being able to deliver services at the end of the day. So with that, I'm going to turn the framing over to Andy Narracott from UNICEF to give us a bit more background before we turn it over to our presenters. So over to you, Andy.
Thank you, Laura. Good morning, good afternoon, good evening, everyone. As Laura said, I'm Andy Narracott with UNICEF in HQ, specializing in safely managed sanitation. And thanks everyone for joining. So next slide, please. So let's begin by looking at those gaps globally. It helps to start with the GLASS data. It's a great starting point to really understand why we're off track and help direct our planning and our interventions to help accelerate progress. The most recent GLASS report that you see here, the Strong Systems and Sound Investments report, takes a deep dive into human resources for WASH and looks at the broader workforce, not just sanitation. And it doesn't just look at service providers, but it encompasses all those WASH functions, as Laura pointed to in the previous slide. But yeah, so next slide, please, Laura. So why is the sanitation workforce? So is the sanitation workforce sufficient? The answer is no. A measly 22% of countries reported having over 75% of the workforce they needed to perform the key functions in the delivery of a sanitation system. And as you can see along the bottom there, those are kind of some of those functions, such as policy development and planning, monitoring and evaluation, regulation, etc., to name a few. And note that these aren't just technical roles. These encompass a whole range of skills and capacities, including things like community mobilization, so social services, and economists for things like tariff setting or regulation, etc. I just a quick segue. I do remember that Manila Water employed, as a result of their huge turnaround, Manila Water in improving services to low-income communities, they hired a bunch of social scientists and social workers to engage with communities. So it's really important that the full range of job functions are encompassed within service delivery. Next slide. So 33% of countries have national HR plans or strategies for sanitation. This means only 2/3 of countries lack a coordinated plan to develop their workforce needed for sanitation. And without those strategies or efforts to scale up sanitation services, especially in underserved areas, it's going to be very unfragmented approach to building the sanitation sector. Secondly, only 24% of countries had enough supply of trained professionals. And by sufficient, we mean, or enough, we mean defined as meeting at least 75% of the estimated need for sanitation professionals in both sewered and non-sewered services. And this is obviously a major shortfall in the education and training pipeline. We need to be investing in the future of our services by investing in training and education now. Otherwise, going to be facing long-term capacity gaps. Next slide, please. Are there any measures in place to protect the workers? This was asked in the GLASS survey, and 73% of countries have policies or plans that include protection measures. So this is a positive sign that majority of countries have these in place for the protection of sanitation workers. But as we all know, policies on papers don't guarantee implementation. So that's a sure sign of regulation needs and enforcement. 68% of countries have national laws or regulations in place, including the kind of roles, things like toilet facility cleaners, fecal sludge emptying, transport and treatment workers, and sewage and wastewater treatment plant workers. But as with policies and plans, having the laws and regulations in place is only likely to apply to the formal sector. And the majority, as we know, many are informal sector workforce, and will no doubt be operating outside those legal or regulatory protections. And then thirdly, 31% of countries had regulatory authorities that enforce minimum protection measures in urban and rural, 26% in rural settings. So without that regulatory oversight, these policies will be ignored and leaving workers unprotected. Next slide, please. So when countries were asked about operational measures to protect sanitation workers, there are a range of responses. So firstly, many countries have measures in place for the freedom of association of workers, and that's the top bar, and that's around, it's a fundamental workplace and human right for people to have that freedom of association. Only 22% of countries do not have measures that allow for the formalization of employment for sanitation workers. And that means that the majority are going to be informally employed with no job security, benefits, or legal protections. And as we know, or as I'm sure many here will know, informal employment just means low wages, poor working conditions, and social stigma, no doubt as well. Another one to point out is at the bottom, the 26% of countries reported that they lack measures to include risks to workers within risk assessments and management plans, such as sanitation safety plans and water safety plans. These are meant to manage the health risks. But in over, as you can see, over a quarter of countries, worker safety was not even considered. So all this data is pointed to a systemic undervaluing of sanitation workers' health and safety. Next slide, please. So let's dig into to understand these findings and why these gaps are persisting. You'll see here that USAID's WASH Pals conducted a study between March and October 2022 that looked into the sanitation and hygiene sector workforce to understand the workforce needs to provide sustainable rural sanitation and hygiene services and focusing on on-site sanitation. And they raised a few of these key questions. So what HR gaps are preventing the sector from achieving access to sustainable services? What methods are used for developing the workforce capacity? What challenges or incentives are in place for developing and retaining the workforce? And what priority actions are needed to address these HR gaps? So next slide. I won't go into the methodology, but this slide just gives you an overview of how that was approached, countries in Africa and Asia. And the study looked at, assessed a range of previous studies, as you can see, and data from like Glass and Amcow and Wallace, and also a number of key informant interviews from international NGOs, development partners, training centers of more than 400 country level informants. Next slide, please. So let's look at some of the challenges identified in the assessment. So first of all, insufficient data on sanitation and HR capacity. The first finding was that there was a lack of disaggregated data on HR, limited standardized job descriptions and titles and competency frameworks. Really inadequate capacity there. On the second, for all countries, sanitation and hygiene just was not prioritized within the sectors and institutions in which they fall. there's challenges with this. You know, for example, sanitation may fall between departments. So it might sit partially within waste management department, but also within social protection or public health. So falling between the cracks was one of the common challenges. They also found that no one was championing sanitation within these departments. You know, and as a result, when it came to fighting over the meager resources available, no one was really championing sanitation to have funding allocated towards it. So overall lack of focus within these sectors and institutions of where sanitation sat. Poor working conditions, number 3. So pay is very unattractive in the sanitation hygiene sector. Poor working conditions, particularly in public sector jobs as well. And let's remember that oftentimes it's very projectized or contract driven in the sanitation sector, and you know, sometimes there's distortionary effects as well from development partner projects as well and donor programs. So really not helpful at all. There's also large gender and age disparities. And there was a significant dependence on volunteers as well, and sort of community-driven, informal sector. Number 4 was limited attraction and persistent stigma. You know, this only aggravated the situation with poor working conditions. So these were persistent barriers and also affected the private sector part of service delivery. So there was a poor business enabling environment as well, and really you know, deliberate efforts to use the informal sector because it was cheaper and could overcome some of those or bypass some of those regulations and requirements as well. So next slide. So just as an example, let's look at sanitation workers. And this is a quick focus on the initiative for sanitation workers. Sanitation, if the problem statement is that sanitation workers provide an essential public service, but often at the cost of their dignity, of their safety and health and living conditions. So if we go on to the next slide, the Initiative for Sanitation Workers was formed of a coalition of different organizations, as you can see there. And the objectives was to support the inclusion of sanitation worker rights within government and civil society, to get it within political agendas at the national and local levels. Secondly, was to influence the wash and labour sectors to ensure that workers' rights are mainstreamed in implementation and monitoring. And thirdly, to support research initiatives and research products to help address those knowledge gaps as well, which can really help with political prioritization and implementation for sanitation workers. So great initiative, and I'm sure that we can provide a link in the comments as well for further information. Next slide, please. Finally, number 5 was insufficient or in supply of graduates from training institutions. For example, there was very little focus on on-site sanitation within curriculum of training institution. So workforce lacked transferable and technical knowledge as well, and skills to allow sort of those cross-fertilization between different functions. There was a big gap between capacity development providers and sector actors, including across geographies, and limited offering of professional development or practical learning opportunities, especially for those who had lower levels of skill. And it's important to note that there are many recommendations that have come out from this WashPal study, and we really encourage you to look at some of those recommendations for inclusion within your programs and plans and strategies to address sanitation human resource. Okay, so there we have. That's a quick overview of the gaps in sanitation human resource globally and into some of those specific causes. So back over to you, Laura. Thank you very much.
Thank you, Andy. That was great. Yeah, there I mean, even outside of the findings of the Wash Pal study, there are a number of other kind of observations. And with capacity strengthening, oftentimes things get simplified to being trainings. And through these next presentations, we're going to see some examples of how capacity is addressed using different modalities, really focusing not just on learning, but the application and being able to actually address, the challenges that are faced on the ground. Always improving the services that are offered. So with that, I'm going to turn it over to our first presenter, which is Maraita Listyasari from the urban development specialist from UNICEF Indonesia country office, and she'll be speaking about driving sanitation progress through human resource strengthening in Indonesia. So over to you, Ita.
Thank you, Laura. Good morning, good afternoon, good evening from Indonesia. My name is Maraita Ita. I'm WASH specialist, focusing on safely managed sanitation and climate resilience. So today, I'm happy to share with you our experience in addressing the issue on human resources in strengthening and accelerating the access to safely managed sanitation in Indonesia. Next, please. So to give you a context, currently Indonesia, the achievement of the safely managed sanitations, it's quite still challenge. So from 7% in 2020, now we only slightly increase in 2024, around 10 to 10 points. 10.20% in 2024. Still a lot of homework to do because we plan to achieve the 30% in 2029. And it's also part of the SDG targets, and then also 70% in 2045. So understanding the big homework on achieving this safely managed sanitation access, now the government committed to include safely managed sanitation as part of the national priorities. So we have this what's so called as this quick win program of the new president has just elected. So this is part safely managed sanitation is part of the program of water self-sufficiency and also rural development. Understanding that there is a lot of impact due to poor sanitation related with health and also to environment. A lot of challenge that still facing by the governments in achieving the access, and amongst others, the low capacities of the institution and also human resources is the main one of the main challenge that we face so far now in achieving the access. Next, please. So as part of the plan, so the government with support of UNICEF, we supported the government in preparing the roadmap to achieve the SDG target in 2030. And then as part of that, we also conducted an assessment on how much, how is the human resources is needed to achieve the global targets and also national targets. So we trying not to only to calculate the numbers, but also to identify what are some the skills, the attitudes, the knowledge that it should be needed to have a numbers, sufficient numbers, and also competence workforce that can support in achieving the targets. So in terms of the focus on the assessment itself, as Laura has mentioned in earlier, so we also see from different functions within the sector, so not only on providing the services, but also on other functions, just like and on enabling environment, on planning, design, and also constructions, to make sure that we can identify a lot of challenges and opportunities to ensure the availability and capacity of human resources in all of the functions. And then the human resources also, the assessment also providing some recommendations on how to address the problems, which then we follow up with some some activities, as I will mention to you now. So one of them is related with so how to address the problem. We divide it into two big targets. One is on the existing workforce, which is the mainly on the working in the within the government institutions, within the local governments, or we call it as existing workforce. And then also on how to make sure that we can have potential workforce or young people to fill in the gap on the human resources that is needed. So on the local government, on the in improving the capacity of the local governments, we conducted several activities, for examples, on how to improve the models on facilitating peers to learn from their peers. It's not only providing some increasing the knowledge, but also facilitating the peers on providing technical support to their peers. So then the objective is not only to increase the knowledge, but also to make sure that the change can happen. So so this is something that's really interesting. So we have pairs of mentor and mentee to facilitate the interaction between the two. And then we also see that in terms of the training itself, we see that the institutionalizations of the training itself is really important. So we work with the training center, with the governments, on how to improve the existing curriculum within the training centers. So for examples, when we improving the topics on climate resilience, so we work with them on how to improve the module on climate resilience in the training centers. And then understanding that there are a lot of gaps in human resources, so we found that there are a lot of effort need to be done to attract more people, particularly young people, to work in the sectors. So we have a partnership with several local universities to increase the knowledge and skill through several initiatives, because we found that there is a gap between what has been taught in the universities and then what is really needed in the real world. So with this partnership, we hope that this is the gap can be closens, so then we can have the knowledge and the skill that is really needed by the sectors. And then in terms of the attractiveness, we're trying to increase the exposure of these young people on the sanitation through some challenges, innovation challenges. We're also providing a report pool kind of thing, so to provide an interest of young people about this about the sector. Next, please. So what has been achieved so far? So the achievement not only so we found that from the assessment itself, there is some follow-up that is conducted by the governments on how to improve the standard competencies, because we the assessment itself found that there is a lack of competency standard on sanitation in the countries. So far, only few competency standard available for a job in sanitations. So then the government decided to improve the standard, so then it can help to ratify the certification scheme for the sanitation worker. And then in terms of the partnership, we have from the partnership that with the local governments, we have conducted, we have developed the database in selected cities on sanitation, which is really important for the city in improving the planning on sanitations. So far, more than 6,000 household has been surveyed with the partnership with the local universities, and then also the local government has succeeded in providing some advocacy materials coming from the data that conducted by the students as part of the advocacy material for decision maker. And then we also see that the peer learning and peer support also resulted in improved governance and capacity of the local governments. Next, please. Despite the achievement that we have, we still have several challenges when we implement the some of the initiative in improving the human resources. We found that the peer learning is very effective because there is a tendency in our case, the local governments really hear a lot from their peers, because they have a perception that their peers know better than, for example, national government, for example, or other stakeholders. So then learning from one to another, one city to another, is really effective. But we found that it is too complicated to scale up so far for this time being, because having this peer learning, because it is not only to improve the knowledge, but also to make sure that the change are happening. So then we really need to have a sufficient numbers of the mentor, which really have the sufficient capacity on doing something, and also to support others. So this is something that really very limited so far now. So then maybe later, if there are more city who advance in the advanced stage, maybe this is we can have more numbers of pairs that we can have from this peer learning. And then so far now, the modality for this peer learning is and on the voluntarily basis. There is no incentive for the mentor, particularly on providing the technical support for their peers, because this is they need to have dedicated time and also yeah, time and others and resources for these processes. So this is something that we found that quite still challenges for us to make it at scale. And then I think another big challenge also happening in strengthening the human resources is also related with the nature of the sector itself. As Andy has mentioned earlier, in also happening in our country, that jobs for sanitation is very less appealing to young people because of these perceptions, because of these low wages, low job security, so on and so forth, as also Andy mentions. So this is something that really struggling for us on improving the attractiveness of the sector itself to young people. So yeah, next please. So this is my last slides on what are some key points or reflections. I think the assessment on human resources is really important as a basis for preparing the human resources plan on how to improve the human resources in more strategic manners. So this is really important. But not only on that, but for country who's like us, we still struggling in raising the priority of the sector in the within the high decision maker. I think having the assessment on on the human resources, which is human resources needed, or we can call it as the opportunity of job. I think this is also provide a good evidence on how the sanitation sector can contributing to economic development through job creation. So I think this is also part of the advocacy. So this is something that also happening in our country, utilizing the momentum of having this sector ministerial meeting, sanitation water for all 2022. So this is something that really for us really momentum and a good opportunity for us to also raise the profile of the sectors. And then we found that there are a lot of different methodologies, initiative on improving the human resources, but I think different objective might require different methodologies. So, for example, if we wanted to improve the knowledge, it will be different if we wanted also to make sure that the implementations can be happening. So with those two different objectives might need different approaches. And then the third reflection, I think the alignment between the demand and supply is really important. It's not only in terms of the numbers, but also, again, to make sure that we have sufficient numbers of the competent workforce. So make sure that for example, curriculum is really aligned with what is needed. I think that is also important. And the last part is, again, this is beyond the human resources itself, issue of human resources, but more on the sector itself, how we can boost the attractiveness of the sector to make sure that we can still have more people to work in these sectors. I think this is really important for us. That's all from me, Laura. Over to you.
Thank you so much. That was, I feel like you had saying that's called, or that goes, there's square peg, round hole. And I feel like that's often what we have when it comes to capacity services. We have a whole bunch of square pegs and we have different sized holes, and we're trying to kind of force the different offerings and capacity into these needs that maybe aren't exact. So it is about taking a step back, understanding the needs, as you say, and designing these professional development opportunities and the delivery of those to really address the needs. So making sure that you have not just square pegs, but round pegs in all different sizes that fits into those holes. So with that, I'm going to turn it over to our next presenters. I'm going to be turning over to Srinithy Sudhakar, who is also accompanied by Mahima Vihindra, both from IIHS, and they'll be speaking about strengthening FSM service delivery, about capacity building and the institutionalization of it in Tamil Nadu. So over to you, Srinithy.
Thank you, Laura. Hope everyone can hear me clearly. So hello everyone, I'm Srinithy Sudhakar, and I'm working as a governance and institutional specialist at the Indian Institute for Human Settlements. So me, along with my colleague Mahima, who's a senior consultant at IHS, we will share our key learnings and insights from the Tamil Nadu Urban Sanitation Program, or the short form of it is TNUSSP, which work towards strengthening fecal sludge management in Tamil Nadu. So we'll be focusing on two key interventions. One is strengthening the capacity of government officers for FSM service delivery, and two is institutionalizing FSM roles for government officers within the government system. First, to set the context, like in many developing countries, Tamil Nadu, which is a southern state in India, long viewed centralized systems or sewer systems as the ultimate development goal, even though many of the official data in the country highlighted that most of the households, most of the population was dependent on on-site sanitation systems or primarily septic tanks for the main method for fecal waste collection. But in 2014, the government of Tamil Nadu recognized that it is important to address fecal sludge management as well. and they issued a policy instrument which was known as Operative Guidelines for Septage Management. In 2016, you can see that the TNUSSP program, which we work with, was launched by the government mainly to implement fecal sludge management, which I'll be using FSM, to implement FSM in the state of Tamil Nadu. And this TNUSSP program was supported by the Gates Foundation. And the primary objective of this program was to scale fecal sludge management across Tamil Nadu. And the IHS team worked as a technical support unit to the government of Tamil Nadu to scale FSM across the state. Next slide. Yeah, so when we started working on the program, the main question which was in our head was, how aware were the stakeholders of fecal sludge management? This was in 2014. We knew that in 2014, there was a policy instrument that was issued for fecal sludge management. But when we started working on the program in 2016, we were still not clear if there was, there was awareness among stakeholders on fecal sludge management, and if fecal sludge was being collected, safely collected, conveyed, treated, and reused as per the provisions in the policy instrument. Like Andrew had highlighted earlier, like, a lot of times there's a policy in place, but that does not guarantee that it is implemented. So it was the same in the case of Tamil Nadu as well. When we started implementing the program, it became very clear to us that there was very limited awareness on the policy instrument, and there was also very limited awareness on fecal sludge management implementation in Tamil Nadu. And what was surprising was that there was limited awareness amongst one of the key stakeholders who we knew were very core to FSM implementation in Tamil Nadu, and these were government officers, government stakeholders, government officers. So our first key intervention was to strengthen the capacity of government stakeholders so that they can ensure effective FSM service delivery. So in order to strengthen the capacity of these government stakeholders, the approach which we used largely aligned to the larger program goals. That was to make sure that whatever intervention that we undertook was at scale. It was not to be limited to pilots, but it was to be scaled. And it also and the other important goal we had in mind was to institutionalize all the interventions that we took as part of this program. So in order to do this, we adopted two approaches. One is a system-oriented approach. When we mention a system-oriented approach, the plan was to link all trainings, link all capacity building initiatives to implementation goals. And also to make sure that all capacity building interventions were also tailored to suit the stakeholders, that is the government officers. So these were some key concepts we had in mind while approaching the capacity of government officers. And secondly, we also made sure that we delivered these capacity building interventions through very adaptive and multimodal efforts so that it reaches the government officers or the stakeholders efficiently. Next slide, please. So here in this slide, you can see some of the key strategies that we adopted by strengthening the capacity of government officers. So recognizing that there was low awareness amongst government officers, the first initiative that we took was exposure visits. When I say exposure visits, we took government officers to different successful FSM sites, whether that was in the country or whether that was internationally. So we took them to a lot of successful FSM sites to make them believe that FSM is a successful model, and also to build the credibility for FSM amongst these government officers. So this helped build a momentum for fecal sludge management and helped the government officers in the uptake of FSM in the state of Tamil Nadu. So this was followed by awareness programs. When I say awareness program, it was like foundational awareness programs to first introduce the concept of fecal sludge management to government officers. So this was the second initiative. So once we built the credibility and we introduced the FSM concepts to them, then we made sure that the trainings, the capacity building efforts became more targeted. So when I say targeted trainings towards the implementation goals, which was also supported by on-ground technical assistance. Just to give an example of what we mean by targeted trainings, as part of our program, when we started building these, fecal sludge treatment facilities or FSTPs, they were being planned as part of the program. simultaneously officers were trained on how to build these systems in terms of where they were provided trainings on designs of these systems. They were provided trainings on preparing detailed project reports. So all these were trainings on these were simultaneously provided to officers so they could implement all the learnings that they received as part of the program. And then subsequently, when these plants were the treatment facilities were being constructed, we also provided a lot of on-ground support to ensure that these facilities were built according to quality standards. So there were both classroom trainings, and these were supported, complemented by on-ground technical assistance while systems were being built. So then once these systems were in place and they started progressing, we understood that there were certain local bodies which were doing well, and then there were certain local bodies which were lagging behind. So in order to support these local bodies which were lagging behind, we introduced cross-learning sessions or peer learning sessions so that they can learn best practices from others. And then finally, we all know that I think in 2020-21, all of us were faced with the COVID-19 pandemic, which disrupted a lot of the in-person activities. So at that point of time, we used alternative methods, like we leveraged digital materials for training. These digital materials not only served as refresher materials, but they also helped government officers, like through self-learning. These were introduced as self-learning tools for government officers, which they could pick up on their own. Next slide, please. So the previous slide, we highlighted on the key strategies to train government officers. This slide, we are just going to highlight a few key enablers that helped us achieve our target goals. First, as we mentioned earlier, linking the trainings, linking the capacity building sessions to actual implementation goals helped motivated government officers to learn and implement at the same time. And secondly, one more important thing we realized through the program was the importance of informal learning platforms. In our case, for example, WhatsApp, we understood the importance of WhatsApp. Like, this WhatsApp actually helped us effectively connect with government officers through multiple groups, and also it helped us address many of their queries efficiently and quickly. So use of these informal platforms also helped us in many ways. Finally, contextualized learning materials. Contextualized learning materials, meaning like all the materials we put out were in the local languages, and we also used other creative materials like virtual reality, and like I mentioned previously, the digital learning materials and all that, which actually helped us make very significant inroads with the government officers. And also this helped us to scale and also strengthen capacity. So as a result of these initiatives, we were able to train around 3,000 plus government officers through these multimodal capacity building efforts. Next slide, please. As we mentioned earlier, one of the program's key goal was not only to build capacity, but to make sure that this capacity or these interventions are institutionalized or integrated within the government systems. And the context in Tamil Nadu was that there was no scope for hiring new government officers. We had to work with the existing setup. So the first part of the first intervention was training government officers. So training just introduced FSM concepts to them and helped them implement it. But sustaining these interventions, it was important to institutionalize these FSM roles, FSM processes into the government systems. So this was a key second intervention, that is institutionalizing FSM roles for government officers into the government systems. So for this, as a team, we mapped what are the key FSM processes and what are the FSM roles for government officers which need to be integrated into the government systems. And then we had multiple discussions with government officers at different levels, local body level, state level, regional level. We had multiple discussions with them to understand what is the best possible way to integrate it into the government systems. We discussed the feasibility of job charts. We discussed the feasibility of service rules or different policy instruments. All these were discussed with the government. And in 2022, as a team, when we were revising the policy instrument in Tamil Nadu, that is like I mentioned, the 2014 operative guidelines for septage management was revised in 2022. And at this point of time, we integrated the government officers' roles for FSM, for effective FSM service delivery as a chapter into this policy instrument, and it was issued as a government order in 2023 for all the local bodies across Tamil Nadu. Again, subsequently in 2023, the government itself took an initiative to prepare a circular on what are the government officers' roles specifically for managing fecal sludge treatment facilities. And a circular was issued in 2023 for all local bodies for managing fecal sludge treatment facilities. Yeah, next slide, please. So in these interventions, you can see on the slide some of the broad barriers, challenges that we face. First, it was challenging to get the government officers to prioritize fecal sludge management at the start of the program when there was no official mandate. As we worked through the program, we made there were a lot of policy instruments issued. There were a lot of act amendments made, but at the start of the program, when there was no formal mandate, it was difficult to get them to engage with it. And also, there was a case of both inadequate and underutilized capacity building resources. One reason for this was because of the focus on infrastructure investments. So the focus was on infrastructure investment, and hence the capacity building investments were sidelined. So we had to, build the importance, stress on the importance of building the institutional as well as a human capacity within the government systems. Also, what helped us was, the push from the senior officials, like, at the state level, the senior officials, the push from these officials also helped us in building this engagement. And mainly the push from the officers helped us in building this engagement. Second, we face some usual problems, like, some officers were, role rigidity among officers, and also the usual things of, when officers get transferred, there's a loss of knowledge, and there were disruptions due to COVID and all that. And we had to overcome this by building champions among the government systems who helped us sustain the momentum. And also we as a team created some institutionalized committees which sustained despite officer changes. So these committees were utilized for introducing, reintroducing FSM concepts, even when officers were changed, when there were transfers and all that. So kind of refresher meetings were introduced as part of these institutionalized committees. Finally, a major problem that we faced was a lack of clear institutional pathways. When we were trying to integrate capacity development into the government systems, or when we were trying to institutionalize government officers' roles into the government system, there was a lack of clear institutional pathway on how to do it. So there was a lot of delay from our end in order to institutionalize it, and there was a lot of back and forth with the government to understand what works with the government and what is the process to actually integrate it. So before we could finally co-develop a feasible institutional path, there were some delays, we would say. Yeah, next slide, please. Yeah. So yeah, to conclude, I think the focus of this presentation was building capacity of government officers, strengthening the capacity of government officers, and also institutionalizing roles for government officers within the government system. But I think as a program, we have worked with other key stakeholders as well, like masons who built the septic tanks or containment systems. And we have worked with sanitation workers as well, who we all feel collaboratively contribute to the effective FSM service delivery. But in this presentation, we have focused on building the capacity of government officers and institutionalizing the roles. So in this slide, we have put forth a few reflective questions based on our presentation on how do we institutionalize capacity development as part of the government systems, how do we incentivize participation, and also for partnerships, how do we scale the institutional capacity, what are the key partnerships that are required to scale the institutional capacity. These are some questions which we would like to reflect on, and also if anyone has, which you also can think through it and can get back to us if you have any questions. Thank you. Mahima, you want to add on to anything? So
well, if we have we have a couple minutes here for Q&A. It's going to be quite tight. Again, it always ends up being that way. But if anybody does have questions, please raise your hand for Srinathi, Mahima, as well as Ita. Or if you can put them in the chat. And Sophie, do we have any at the moment in the chat?
Yeah, so we have one hand raised and one question posted in the chat. So in the chat, we have one question from Henin Soa, who was asking during Ita's presentation to ask a bit more details about how they did strengthen the capacity of management staff and whether they had some support from a specialized organization to do that. So perhaps we'll start with that question to Ita, and then we'll have a hand raised by Nzuzi Kitondi that appeared during the second presentation.
So Ita, I don't know if you want to respond, and then we'll go to the question from the gentleman.
Sorry, can you hear me okay now?
Mm-hmm.
Okay. Yeah, thank you for the question. So, how to improve the capacity of the management staff, whether they have the support or not? Yeah. So, actually, the government, the government usually have the regular programs on improving their capacity. From the Ministry of Public Works, they have programs on improving the capacity of the local governments from different districts. So they are invited to the training centers to join the trainings, or beyond that. Actually, the other ministers also providing different modalities for improving the capacity through, for example, conducting the advocacy horizontal learning event, for example, so they can all of the cities, districts can share their experience, the knowledge, so then others can learn from another cities. So basically, there is regular programs provided, but actually it's not enough because we also found that the turnover in the local government in the management staff is really high. So those who has received the training, it is very common that they are also assigned for other positions. So then the development, the training that we have conducted so far still is not enough, because we are receiving new people also coming in the sectors. So there are so this is something that we feel that although the effort is there, but still the gap on the expertise of the peoples in the assigned position still is very low because of this high turnover within the government staff. I hope I answered the questions. Over to you, Laura.
Thank you. And I believe it was Nzuzi Katondi, you had your hand raised. If you want to come in with your question. If not, are there any other questions in the chat, or feel free to raise your hand. Okay, go ahead, Nzuzi.
Hello?
Mm-hmm. We can't hear you. There, you're unmuted.
Ok,
Perfect.
ok. Ok, donc je vais poser ma question en français, s'il vous plaît. Mon anglais n'est pas très bon. C'est concernant la présentation des l'Inde. Acho que c'est Madame Sudhakar. Concernant l'institutionnalisation des agents qui travaillent dans le secteur WASH. Je voudrais bien savoir quels sont les défis qu'ils ont rencontrés, parce que je sais bien que le processus est en cours. Nous avons essayé de le faire chez nous ici en Angola, Donc, le défi est très, très majeur concernant surtout leur rémunération, parce qu'il faut qu'ils soient insérés dans le système gouvernemental. Et cela n'a pas été facile malgré, disons, l'appui des partenaires. Maintenant, quelle est l'expérience de l'Inde, s'il vous plaît? Nous sommes très, très intéressés pour savoir et essayer de l'appliquer ici. Merci.
Laura, it would help if someone could translate that for us, please.
Yeah, we lost
okay.
interpretation, sorry.
Okay,
Thank
no,
you.
I'm happy to translate if that's helpful. So he was sharing the experience of Angola, where it was a major challenge in terms of institutionalizing, especially through the salary, institutionalizing remuneration in government staff has been a real challenge. So he wanted to hear more about India's experience with this.
If you can just give a quick response because we are out of time, but that would be great.
Okay. Unfortunately, we really couldn't get into that side of the government capacity building, which is looking at salaries and remuneration. So this was also because, the institutional ecosystem is really complex. And what we were trying to do here is integrate things into what was existing, what was already there, the same sort of ecosystem. And working with that, we had, for instance, considered even setting up a separate FSM cell just to execute, manage the introduction and scaling of fecal sludge management across the state. But that was, shot down by the government saying there's a freeze on recruitment and we're not going to do that. So the entire area around remuneration and how, different stakeholders, not just the government officers, but other, people involved in sanitation delivery was not something that we really looked at. It is something that kind of gets covered in the broader sort of reforms that the governments take up. And we weren't focusing on that specifically. And what we were looking at is how do we instead improve their capacity and their ability to deliver their roles and responsibilities. But we did, for just one quick thing to add, on the sanitation worker side, look at how we could improve, their social protection, their access to welfare schemes, improving their health and safety. So not directly, but looking at it from the perspective of funds that they're receiving for the delivery of their, roles and responsibilities is something that we did try and look at. Yeah.
Thank you. And we do have one more. I am gonna ask Ibi Yemi if you want to come in really quickly, and then we'll do a quick response and then turn it over to Dr. Tambi for closure. We're going to take a couple extra minutes to close. But if you want to come in really quickly with your question.
Okay, thank you. Well, thank you for the presentation. I'm Mr. Oludana SBM, Director of 3 Water Quality Control and Sanitation from Federal Ministry of Water Resources, Abuja, Nigeria. I'm asking, we have a department called Urban Sanitation in the ministry, under my department. So I'm looking at an area of partnership with the department in the ministry, where you can train, build capacity of our officers in the department, in the area of fiscal sludge management and reuse. I want to see if there's going to be any modality that you adopt to collaborate with us so that we can know when you come with us, come to the ministry for capacity building of officers. Thank you.
Does anybody want to come in and respond?
I'm not sure I fully understood the question. Maybe I'll just repeat it to make sure we've got this. Is the question around how we partner at the at the national government level for capacity building? Is that the question?
I think there was interest in learning about how this could be transferred to kind of Nigeria, but learning as you suggested, your question is probably the best way to kind of to answer about how you've done it.
Yes, I think Srinidhi sort of alluded to it. So it is about how, I mean, we are trying to integrate this into government systems. So both at the national level and at the local state government level. And at the state government level, it's a lot more advanced in the sense it's forming part of how the entire service is, the services are delivered, and the sort of roles and responsibilities of officers. But capacity building in itself, yes, we're seeing if it can get into the training systems within the government, both at the state government level as well as the national level. And at the national level, we see it's happening. There are partner organizations that focus, for instance, the National Institute of Urban Affairs focus on training officers and different stakeholders on sanitation service delivery. And so the lessons from the program that we're implementing in Tamil Nadu is getting into those kind of training programs and capacity building initiatives at the national level. So it is not just focusing on Tamil Nadu, but saying how we can scale these learnings across the rest of the country and internationally as well. Srinidhi, I don't know if you want to add anything to that quickly.
No, I think nothing there, but I think like we also mentioned in the presentation, our collaboration started with the Gates Foundation. We had a partnership with them at the start of the program to work with them. So we are looking to understand what we had a MOU with the government of Tamil Nadu and with the Gates Foundation to work on this program, TNUSSP. And as part of this, I think one of the key components was capacity building, and that's how we initiated it. And later, I think what Mahima was saying about what were the approaches, interventions, how we went about it.
Great, thank you. All right, sorry, we are at time. I know there's probably other questions, but I'm going to turn it over to Dr. Tanvir for some closing reflections, takeaways. So Dr. Tanvir, if you're online, over to you.
Okay. Thank you very much. Hopefully you can hear me.
Yes.
Yeah. So first of all, I'd like to congratulate all the three presenters. Wonderful presentations, and I think, these all presentations are so well-rounded that it's very difficult to say something after these. And so let me just try to do my best here. Of course, the first presentation was from Andrew, and what he tried to highlight is that the recognition of sanitation workers, that was the core part of the presentation. And one thing that we all realize, that in this business of safely managed sanitation, the sanitation workers remain as the most unsafe part or the unsafe element so far. And while we are trying to promote safely managed sanitation, it is being highly regarded, and the spotlight is actually on them, that this is one place we have to work very, very tirelessly, because it's severely lacking behind, and it's an awful scenario. And it appears that it all boils down to how we recognize this work in the sanitation value chain. Their treatment, how much they are paid, what the social stigma, and what better occupational health and safety provisions we can make for them. It appears to be, tied to how we recognize their effort and recognize their job itself. And that has to be, I think, the core point here, the recognition. Andrew also alluded to the fact that we have a severe, lack of trained manpower in order to achieve SDG 6.2 globally, and this was taken from the recent GLASS report, and this actually formed the next basis for the next two presentations and for capacity building. Capacity building has been seen as a way to actually complement this gap. And we have seen through these presentations that capacity building, it requires skilled individuals. They need to have the knowledge for the job, and it has to be all throughout the sanitation value chain, and also for people working at all aspects of sanitation delivery. It's not that we train a bunch of individuals and do some professional capacity building programs for them. It will not work. It has to start from the very beginning, and it has to involve all people who are part of this inclusive sanitation agenda. And that's the reason why we see from Maraita's presentation and from presentation from Sriniti and Mahima is that capacity building is not only training. It's a bunch of activities starting from peer-to-peer learning. We've seen twinning programs in Indonesia, sister city or mentor city programs. They have partnerships with universities. They're trying to work with young people, young students as well. And it's also, capacity building also involves exposure visits, awareness program, refresher training, digital learning, as they mentioned in happening in Tamil Nadu. And also very important is the hand-holding support that they provide to the FSTP operators, helping them in designing, construction, and all these things. So we have to take this notion that the capacity building effort or the capacity development is inclusive of all of these. And we have to try our best to lower the gap in this capacity building effort through hands-on professional development and a bunch of all these activities. One thing that was also highlighted is that even as we know what sort of capacity to build and what to do and how to do it, there still remains some challenges. That was very nicely highlighted by both the presentation from Indonesia and Tamil Nadu. In Indonesia, they've seen that we've seen that they're struggling to scale up the peer-to-peer learning, probably due to lack of resources. And also due to the unavailability of sufficient peers. That's important because we build up one or two cities, a bunch of mentors, but then they have to, how do we support them to keep continuing this effort? So that's a big problem. We've seen that the young people are not very interested to go into sanitation jobs. So we have to work somewhere over there to make this job more attractive to them. And the wage structure and everything, all the ecosystem around with jobs, and this has to be an attractive job. This has to be, they have to feel that this is a very important job that they do. And lastly, what they, and also I've seen a lot of questions hovering around it, how to institutionalize this capacity building activities in the system. We've seen challenges, real challenges, and there's also similar things we see in Bangladesh as well. How can we actually institutionalize this FSM service in the existing organogram? We've seen that the government officials are already overburdened with their existing job structure, and they're already, and if you impose this FSM activities on them, they're very much unwilling or reluctant to work. There are also the same problem here. We have officer transfers. So after this transfer, we have to refresh them again with them. And there are also clashing roles and also some underutilization of capacity building resources. So we've seen similarity of challenges all across this global south. And we have to somehow, I think, we have to navigate through all these challenges, find a way to effectively address some of these issues, because these issues are going to come around over and over again. And we have to think hard on how to bridge these gaps. So that's all from me. Thank you very much for inviting. And again, congratulations to all the three presenters for the lovely presentations. Thank you. Thank you very much.
Thank you, Dr. Tanvi. That was fantastic reflections. That is everything. The recordings of this series are available on Susanna. Please go there to revisit some of the previous sessions as well as this one once it's ready. Thank you again for joining us, and thank you for giving us the extra 15 minutes. It's been really a pleasure to have these discussions. All right, and with that, we will close. Thank you, everyone. Bye.